I am Naveen Hedne, head and neck cancer surgeon, Apollo Proton Cancer Center, Chennai. Oral cancers are a group of cancers which affect the mouth and surrounding tissues. Cancer is uncontrolled growth of cells which results in destruction of tissues around the cancerous tissue, which involves the normal tissues and results in destruction of normal tissue. India is called the capital of oral cancer because we have the highest incidence of oral cancer. About 20 per 1 lakh population is affected by oral cancer, and about every minute 5 people lose their life because of oral cancer. The commonest age group for oral cancer is about 40 to 50, and male are more common affected than female. Oral cancer can affect any part of the mouth, starting from lips, gums, around the teeth, jawbones, that is lower jawbone, upper jawbone, then the palate or the soft palate which moves when you speak, cheek. In India, the commonest site of oral cancer is gingivobuccal sulcus, where we keep the tobacco quid or tobacco, the pan masala. It's called Indian cancer. It can affect also lips. In the West, the commonest cancers are lip compared to India, where it is GB sulcus. Tongue cancers are common. Tongue cancer can also be affected in individuals who don't have any risk factors, and tongue cancers can be more aggressive than the rest of the other oral cancers. Does biopsy increase the disease? It's a myth. Biopsy is necessary for the diagnosis of any cancer or to rule out cancer. So, biopsy is the first step in diagnosing the cancer. Oral cancer are curable. Yes, it's a fact. Oral cancers are curable. The cure rates vary from 90 to 60% depending upon the stage of diagnosis and the type of treatment you receive. First chance is the best chance to treat any cancer. Earlier the detection, the cure rates are higher. The quality of cure is what matters now. It's not just the cure, the quality of cure or quality of life after cure is what we or anybody should look at. People who consume tobacco are only affected by cancer is a myth. People who consume tobacco are at a higher risk of developing oral cancer. Oral cancer can affect anybody. Even a person who doesn't have risk factor can develop oral cancer. Even a sharp tooth. Sharp tooth is one of the commonest cause in person who doesn't have risk factor to develop oral cancer. Oral cancer patient always need radiation or chemotherapy is a myth. Oral cancers can be treated either by surgery or radiation, and chemotherapy is always added to either of these treatment. Earlier, like early stage tumors are always treated with single modality, either it can be surgery or radiation. As the stage progresses, like stage 3, stage 4 cancer needs surgery followed by radiation or chemoradiation. Oral cancers can be treated with alternative medicines or religious methods is a myth. Oral cancer cannot be treated by alternative medicine or religious method. Oral cancer needs to be staged and treated accordingly with current guidelines. Oral cancer treatment reduces the life of the treated patient is a myth. Oral cancer treatment is very important, and right treatment will give a normal life to the patient. As I told, early detection is the key here. You diagnose the cancer at the earliest, you can get the best treatment and you get back to the normal life. Oral cancer treatment always means disfiguration of face is a myth. Treatment of oral cancer results in some morbidities or disfiguration. Nowadays, with current advances in surgical practices and development in plastic surgery, we replace tissues with like tissues. If you remove skin, we replace skin. We remove bone, we replace bone. You remove teeth, we can give teeth back. Currently, as I told you, it is not the cure, it is the quality of cure which matters. Oral cancer treatment is expensive, is a myth again. Treatment of oral cancer is simple, and as I told you, diagnosed earlier can result in treatment with lesser cost because you result in single modality treatment, that is either surgery alone, radiation alone, and most of the oral cancer affect a individual who is in his productive life. So, you treat them well and rehabilitate them well, it is not a financial burden or it does not cost much. Is oral cancer communicable or transmissible between individuals? Is a myth. Oral cancer are not communicable, they are non-communicable diseases. So, it does not spread from a person to person, it does not spread from person to person in the family or across the family or the treating doctor or a physician. So, it is a strong myth again. Search engines have all the answer for treatment of oral cancer. There are some good things and bad things about the search engine. So, we need to look for right information in the web. There are right information and wrong information in the web. So, you need to look at the current guidelines, evidences. There are websites from UICC and NCCN which set the guidelines for the whole world, and you cannot say that web does have everything related to oral cancer, but it can definitely help if you look into the right direction. So, today we busted some myths and facts about oral cancer, how to go about treating oral cancer, what are myths, what are the facts, and what is the right way to go about treatment of oral cancer. Hope this was helpful. Stay safe, stay healthy, stay informed. If you or anyone of your family you come across with these symptoms, kindly visit a doctor at the earliest.